Osteoarthritis is a very common form of arthritis and one of the major catalysts behind the need for knee replacement surgery. In recent decades, partial knee replacement has become an option as opposed to a total knee replacement. In this week's Doc Talk, CBS 21's Ed Russo takes a closer look at the benefits of a partial knee operation.
The following segment is sponsored by Geisinger Holy Spirit.
The knee joint has three parts: the tibia, patella, and femur.
It's a different joint from most joints in the body in that it also has two shock absorbers called the meniscus that are little shock absorbers, medial and lateral meniscus. They're made of a different type of cartilage called fibrocartilage that adds stability to the knee and also cushioning.
Similar to how shock absorbers add stability to your car. And like a car, if your knee isn't working properly, you may only have to fix a part instead of replacing the whole.
Ideally, it'd be great if you didn't have to replace any part of the knee. So the indication for either one of those surgeries is end-stage arthritis, where you don't have any cartilage left in the knee.
Karen Gibson, a patient of Dr. Werner's, received a partial knee replacement.
Well, there is pain, of course, to be associated with it, but it's well controlled through the medications and, of course, the ice, keeping it elevated. You're going to take gradual steps with it, of course. And from there, just control, and monitor yourself.
While there is still some pain after a partial knee replacement, it's not nearly as acute as a total knee replacement. Partial knee also preserves the healthy cartilage and ligaments.
So what happens is the motion feels more natural because the patient's own ligaments are still there.
And when you preserve more of the knee through a partial knee replacement, your recovery is faster post-surgery.
Oh, I'm great. I was back bowling 3 weeks after surgery. I was back swimming 5 weeks after surgery.
Genetics aren't the only big player in knee arthritis.
And I see a lot of patients, they're like, well, how did I get knee arthritis? And I said, well, what about your genetics? And they say, everybody in my family's fine. And then you start asking them and they're like, oh yeah, well, I broke my knee or tore something when I was in high school football.
Anytime you feel your knee joint isn't working properly, get it checked. You want any knee surgery to be as minimal and partial as possible. For this week's Doc Talk, I'm Ed Russo for CBS 21 News.